Welcome to 325 Dunlop, the future home of Mercy Medical Ministry and Clinic. How about a tour? Follow me. I want to first take you through the east wing, which is the clinical wing. We have some construction going on. This is where the ministry and the medical care happens. The north wing is where the administration happens and meeting rooms. What I'd like to do is act as though you're a first-time patient, so follow me out of the parking lot into the building. We enter the front porch. This is the waiting room. It will accommodate 20 plus people. Come up to a medical student who is on staff and hired by Mercy. They're enthusiastic and are just a huge plus to the clinic. They will process you and they'll bring you back. They'll hand you over to another Auburn student who is a volunteer, probably in pre-med, maybe pre-nursing. They will bring you back to the clinical area. The clinical area has basically two mirror image sections. Both have everything. The other has 8 exam rooms. It has a place for the spiritual encouragers to be there until they go see the patient. Both have pharmacy wings. Both have intake rooms where the pre-med student takes vital signs, may draw blood, things of that nature. So follow me. Here is what we call the control tower, where Miss Julie and the volunteer students kind of run the day and run the patient flow here. All right, we'll walk through the 8 exam rooms on this side of the east wing. Exam rooms either side. Let me show you one thing here. I'm sorry. Every person passes through here, whether staff or patient. This window is going to be basically the symbol of Mercy Medical. There will be a huge wooden rustic cross right here in the window with stained glass surrounding it, so that when the sun shines through, it splashes all over the center of the clinic and draws people's attention to the very reason Mercy Medical is here. Very excited about that. Follow me. The exam rooms, you would be put into an exam room and you'll be seen by either a volunteer physician, I being one of them, or a nurse practitioner or a PA. You'll be seen clinically, given medical care. An MA, medical assistant, who is also usually a graduate of Auburn University and doing a gap year, will kind of orchestrate the flow when you're back in your room. After the clinician leaves, then a volunteer spiritual encourager enters the room on every patient and connects with them, just gets to know them emotionally, spiritually. They offer prayer with them, and if the patient is receptive, we even talk about the hope of Jesus Christ. This is the procedure room if you need a procedure, minor procedure. And then over here is a large room where the East Alabama residency, internal medicine residency, hangs out with faculty, and they discuss every patient they see. They come 2 days a week, and they're a tremendous help with the clinic. And they get inspired to do this kind of thing when they get out there and start their practice. This little corner here is where we will educate people on healthy living. We'll have exercise machines and weight machines, and we may do some physical therapy here. So excited about that. Then we're heading up between 8 more exam rooms on this side. Whoa. Thank you. All right. So here also is a place for the spiritual encouragers and the pharmacy. All right, we're not gonna, I'll tell you what, we will quickly look at a couple of things in the administrative wing. We'll go through actually the walls here, if we can. This is the break room where volunteers and staff will hang out, have lunch, whatever. Out here is an outdoor porch or portico. And within the L of the building, we're going to have a large garden. which is going to be quite a neat touch. Patients, staff can go out there and just kind of take a break and be out in God's nature. Very excited about that. All right. This is a large meeting room that is literally 4 times bigger than anything we have at our present facilities. We'll have Bible studies, worship time, educate patients. We can put desks out here and have 40 people at a desk doing workshop type things, or we can have 70 or 80 people with just chairs. Beyond that are multiple offices for the administrative staff and the leadership. So that's basically it. Let me say this. Thank you so much if you've already been a part of contributing financially to this endeavor. If you haven't, then I ask you to pray about being a part of this. The need is great. We've gone through $4 million to get it dried in, and it takes $2 more million to go from dried in to finished. The need is big. I ask you to pray about being a part of this. If you do, I know that it will be an investment in your eternity and all the patients' eternity. Thank you.